Everybody, and welcome to the inaugural ACR Chapter Town Hall. My name is Tanya Coogan, and I am the Manager of Chapter Development for the ACR, and I am thrilled that everyone has been able to join us. I thought I'd give a couple of quick stats on who we have registered and who's going to be joining us this evening. I'm really happy to say that we have 75 registrants that are to be joining us. Of those 75 registrants, we have 28 chapters represented. About 14 of them are chapter presidents. We've got about 8 president-elects, about 15 counselors, and 9 chapter staff. So I am thrilled that you are all able to be here. We do understand that your time is quite valuable, and so we intend to definitely honor this hour, and we will end promptly at 9 p.m. The housekeeping portion of this, as I had stated earlier, everyone on the call is going to remain muted for the entirety of the call to maintain the integrity of the recording. It is intended to have you provide any input, feedback, or questions throughout the presentation. And you can do that. If you look on the right-hand side of your screen, you're going to see a questions tab. Anytime you have input, a question, something you'd like to have addressed, go ahead and type that in, and I'll be fielding those. If it's appropriate, I'll do a quick interruption and insert that question or comment at that time. If not, I'm going to save it to the end. If we are not able to get to all of your questions or comments, please know that they will be addressed post-call, so nothing's going to be left out there hanging. And really, with that, it's my honor and pleasure to go ahead and turn this presentation over to the chair of the ACR Board of Chancellors, Dr. Bibb Allen.
Well, hello, everybody. I'm Bibb Allen, and I'm here in Birmingham, Alabama tonight, and looking forward to sharing with all of you our new strategic plan for the college, what went into the process, and what direction we're headed. I want to start out by sending along Bill Thorworth's regrets. Bill is the new Chief Executive Officer of the college. Many of you probably met him at the annual meeting. Many of you have probably known him like me for years because he's been a kind of one of us in the trenches for a number of years, and I feel like the college was real fortunate that he decided to change directions and come on board for us as the CEO. Tanya, I want to make sure now that everyone can see my screen. Is that where we are? So
correct. Yes, we're all able to see that bumper slide of yours, the opening slide. So if you'll let me know when you switch to the first slide, I'll tell you that it's working.
I've got the first slide on my computer if you're ready to switch.
Okay, let's do it.
All right. So I'm going to start out just sort of talking a little bit about, why we do strategic planning, what our process was, a little bit about how it turned out and how we plan to use the plan. And as Tanya said, if questions, come up during, and there are a lot of them, she'll just interrupt me and we'll take them on right then. If not, save them and we can talk about it at the end. But know that this call is not totally about the strategic plan, and it can go any direction you want it to go. I'm not going to monopolize it by any means, and probably can get through this stuff in 20, 25 minutes maybe. We'll see. I didn't really time it exactly, and then hopefully have a good half hour or so left for everything. And it can be from operational issues for the college, and Brad and Tanya can take care of those questions. There may be some other ACR staff on the call that can answer questions like that. Certainly I'll try to field all the doctor-related questions from the board, but if there's anything that comes up and your guys on the call here don't know the answer, either we'll check with other staff folks at the college, or I'll check with other board members to make sure that all those get back to you. So strategic planning is basically a roadmap for our future, and of course, since we're were all doctors that were involved in our strategic planning committee, we thought that part of what we wanted to do was to look at the future of the profession and where our profession was going, so that we could make the plan for the college in line of serving the needs of the members and the profession. We want to use the plan to set our priorities and focus our resources, and we want to be able to have a plan that basically articulates a shared vision. I think that's probably the most important part of whether or not our plan will be successful, is if the college is doing the things that our members want us to do. And so that was really important. We didn't take the strategic process, planning process lightly. It actually took a whole year to do, and there was very broad representation on our strategic planning committee. It included members of the Board of Chancellors. It included members of the Council Steering Committee. It included members of the Young Physicians section and Resident section, and actually some members who were neither members of the board or the steering committee. I don't know how many of you have engaged in big strategic planning processes, but I learned that having a strategic planning consultant can be invaluable, and we worked with Tecker International and Paul Meyer in that company, facilitated our strategic planning, and we had 4 days of committee meetings dedicated to putting the plan together. We had another discussion at the ACR Board and Council Steering Committee meeting in September, and that's when the final approval was, and I hope everybody got our email and has checked it out. One of the most important things that we did in putting the plan together was looking at the environment and getting research from our stakeholders. And this actually took several months to do that, and this is where Tecker was very beneficial to us, because we thought we needed to totally understand what was going on in our environment, look at the needs of our membership. The research assessed threats and looked for opportunities. We had input from external stakeholder groups that included hospital administrators, industry leaders, the leaders of our other radiological organization, as well as patient advocacy groups, and of course our friends, the policymakers. But most importantly were our internal stakeholder groups, and that included our ACR staff, both our current and ACR, our current and potential ACR members, the residents and young physicians, current and past ACR leaders, and really most importantly our state chapter presidents and officers and leaders like you guys, as well as a survey of the entire council. And so it was that research that we considered, and those internal stakeholders, most important. And so if any of you guys participated in any of those surveys or answered any of those questionnaires, I really do appreciate it, because the committee was committed to trying to make the plan follow what the direction that the research took us. We started again, as I said, in January of 2016 with a design session, and then over the next few months we collected the research that sort of went through the annual meeting. At the board meeting, we sort of had a environmental scan session with our board members where we kind of whiteboarded some of the big issues that we thought were facing the specialty, and then over 3 days in the summer, 2 days in June and 1 in August, we kind of put together the plan and presented that to the board in mid-September, where it was approved. We are now in the process of using the plan to basically test and look at every program in the college. That's our program assessment that we're doing, and we'll have a report on that to the board in January. But the implementation of the plan will be ongoing. So let's just talk a little bit about what the plan consists of. It consists of the core purpose and core values of the college. Some people might call that the mission statement. It includes a vision statement and a vivid description of what we think our envisioned future is. It's like if you could make radiology anything you wanted it to be, what would it look like 10 years from now? And if we have that future, then what are the goals and objectives that we need to take us there? In looking at the research, one of the things that I was really struck by, as well as the committee, and that was that overwhelmingly people who participated looked to their professional organizations, and the college in particular, as a career partner. That is, how can our organizations help us to do our jobs and take care of our patients better? Probably no surprise to any of us that advocacy, economics, and quality and safety continue to be a focus for our members. But there was certainly concern about how are we going to transition to potential new payment models and even new practice models as more and more physicians become employed. And what will a professional organization need to look like for employed physicians? The research told us the importance of state chapters and member engagement, and the idea that we need to be rowing the boat in the same direction. So collaboration with other radiological organizations to avoid duplication of services and to make sure everybody's sort of on the same page and going in the same direction was important. So in the book Built to Last, Collins talks about the core ideology. That is the core ideology that clarifies, for us what doesn't change about an organization. What is, what are we going to stand for in the environment of unpredictable change? What about us is the core piece, and it consists of a core purpose. That is a concise statement of the organization's reason for being. Paul told us in our strategic planning committee sessions that the Disney core purpose is make people happy. Just simple statements like that, and a set of core values that are considered essential and enduring tenets of the organization, basically timeless guiding principles. I don't know how many of you remember the ACR's previous mission statement, but it was kind of long. The mission of the college is to serve patients and society by maximizing the value of radiology, radiation oncology, interventional radiology, nuclear medicine, medical physics by advancing the science of radiology, improving quality of patient care, positively influencing the socioeconomics and practice of radiology, providing continuing education for radiology and allied health professions, and conducting research for the future of radiology. That was our old mission statement. Our new core purpose is simply to serve patients and society by empowering members to advance the practice, science, and professions of radiological care. And when you boil things down to it, words were important here, and so there were a few words that I want to point out to you that we use. First and foremost, just like before, we're here to serve our patients and to serve society, just because as doctors, that's kind of what we do, right? I mean, that's our purpose in our profession. But how an organization can do that is the organization can't do it for us. The organization exists to empower us to be better, to advance the practice. So the one first real difference between these mission statements is empowering the members to advance the practice, science, and professions of radiological care. And you'll see throughout the strategic plan that radiological care is there to include all of the professions of radiology, whether it's diagnostic radiology, interventional radiology, radiation oncology, nuclear medicine, or medical physics. Our core I think should be in line with what we all hope to achieve in our practices: leadership, integrity, quality, and innovation. When we look at the vision of where we want to be, where we're going, The previous vision statement was to be the recognized leader for safe and effective radiological care through advocacy, economics, education, research, quality, and safety. Our new vision statement, again, is about the members, that ACR members are universally acknowledged as leaders in the delivery and advancement of quality health care. So again, changing the focus from maybe an organizational-centric view, our organizationally pillar-centric view, to how can all of that work together so that radiologists can become the universally acknowledged leaders in healthcare. Now, this is this is meant to be small and unreadable. I mean, it's part of the strategic plan, and I hope that you'll take a look at it. But it defines where we want to be in the future as an integral part of the healthcare delivery team. It talks about being members of the team. It talks about radiologists being valued throughout whatever changes come about, that radiologists can continue to be satisfied with their practices, their professional opportunities, and that medical students continue to be attracted to the profession. So the plan consists of goals and objectives. The goals and objectives are ideally suited to look at the next 3 to 5 years, to look at the outcomes that we're committed to achieve. And the objectives are how we're going to accomplish the goals. Our goals and objectives are centered around 6 basic areas with 25 supporting areas. Goals center around healthcare payment policies and practice models, membership and member engagement, radiology and patient-centric care, taking innovation and research from science to practice and public policy, focusing on external relations, and then financial stability for the organization. So let's just go quickly through these. I'm not here to read the strategic plan to you, but basically to kind of tell you a little bit about what the committee thought when putting the plan together. So around healthcare payment policy and practice models, that existing and new practice and payment models will recognize the value delivered by radiologists, and ACR members are prepared to adapt and thrive within the models. The objectives, and you can read them as we go, but they recognize the problem that while healthcare reform will likely bring changes to the way we practice in the future, it's imperative for radiology to maintain its current relative value under our existing fee-for-service model. So basically no real change in our current economics programs or our lobbying efforts, or anything that we depend on to preserve our economic activity. In fact, the objectives in this goal actually prioritize minimizing further fee-for-service payment reductions, but at the same time call for increasing the ACR's leadership role in defining and promoting new payment models that value radiology professionals in the delivery of high-value, patient-centered radiological care. And through communication and education, prepare the members to transition and thrive under the new payment models. While advocacy for appropriate reimbursement under all the payment systems continues to be our major objectives, we also recognize that advocating for public policy that supports continued funding for things like graduate medical education and research are critical for our future success. So that takes us kind of through the healthcare payment policy. The next big focus of the plan was on membership and member engagement. And the idea of the goal here, grow and retain the membership and foster meaningful member engagement. And you can look at the objectives in this one, but the emphasis is on creating partnerships with the membership, partnerships that support your practices, and partnerships that will help us together advance our profession. The objectives that are critical to achieving this goal are to maximize the member benefits relative to the cost. Obviously, we are at a time when there are always more opportunities than resources, and so we want to make sure that the things that we do at the college are things that bring the most value to members for relative to the cost of membership. Not only in the economic and political advocacy, but at the level of our individual practices. How can the college make you more valuable in the way you practice radiology? Recognize that effective communication is critical to member engagement. So we understand that effective communication is central to satisfaction and participation. Goals support diversity, obviously, in our practices, and because our young physicians embody the future of the profession, we have specific objectives about supporting residents, fellows, and young physicians in their engagement in the college. The next goal is about our patients and radiology and patient-centered care, and the goal is that radiology professionals consistently employ the best radiological practices through the continuum of disease detection, diagnostic evaluation, and therapeutic care. And so it focuses on things like screening and population health through disease detection, our quality, our safety, and our patient-centered diagnostic evaluation, and also therapeutic care. The objectives recognize that optimal care is not really limited to providing accurate interpretations or successful interventions and treatment, but it begins when the diagnostic evaluation is first considered and goes all the way through the continuum of care so that the patients and the referring physicians have a clear understanding of the results and recommendations. That's our idea of what patient-centered radiological care will look like. It'll delineate how the ACR can partner with the members to achieve the goal. We want to increase the range and applications of tools available to the radiology professionals and our members to facilitate patient-centered care, to promote the value of radiology and our radiology professions as stewards for the patient in every aspect of radiological care by promoting things like early disease detection through appropriate screening and enhancing the ACR's role as a leader in radiological quality and safety, and to build a universal understanding, whether it's within the House of Medicine or amongst the policymakers or amongst the public, that the radiology professionals' roles and value in integrated delivery teams is important, and that radiologists are important in population health as well. The next goal is taking innovation and research from science to practice and then to policy. The goal is around economics and advocacy, and man, it's been fun to be able to go and talk to policymakers about all the great things that have been happening in radiology over the past decade to 15 years, and the great things that we've done in advocating for appropriate compensation for it and lobbying for coverage and all those things. But without the research that drives those innovations, there would be nothing for the college to advocate for. And so I think that we have to consider, the value of research to our profession. The next thing on the horizon, the National Lung Screening Trial, is something that we've been working with CMS on the last couple of months, and it wouldn't exist without the coverage for lung cancer screening wouldn't exist without the Akron-sponsored NLST. So I think that focusing on research, but not just the research itself, but actually the research that gets us to practice. Not just can we do it, but should we do it. So research is not just about that science, but it's also facilitating the information technology tools that will support our value proposition. It's about doing the health service research that's going to help us bring these new tools into radiologic practice. And at the same time, we want to be able to expand the funding streams. That is, how can we get more foundations involved, more grants involved in supporting research for our specialty. So these are some of the things that we're doing regarding promoting these solutions and optimizing patient outcomes, and promoting that to our federal and policymakers and external stakeholders in that regard. So the next goal is around external relationships, and uniformly the research told us that we need to row the boat in the same direction within our own house of radiology. The Strategic Planning Committee heard that loud and clear. We want to be sure that our specialty has a unified message coming from our organization, and we want to be sure that our organizations can work collaboratively and efficiently so there's not a lot of duplication of services. Now, at the same time, external relations goes to developing collaborations between non-radiology organizations and other non-radiology stakeholders to increase the opportunities for enhancing the recognition of and value of radiology professionals that we bring to the healthcare delivery team. We want to increase our coordination and collaboration, and we want to expand the understanding to all of our external stakeholders about the value of radiology in healthcare, and those guys would include the government policymakers and regulators, the healthcare administrators and other medical specialties, as well as patients in industry. And finally, we want to strengthen our alliances with our patients and work with patient advocacy groups to, again, make sure we all are rowing the boat in the same direction. And then finally, we can't do anything without financial stability, and so obviously we want to maintain whoops, sorry about that, guys. Let's see. Oh, Steve Jobs is helping me make sure my computer was up to date. But we want to make sure that we have the resources that we need to complete our strategic plan, to make sure that our initiatives and resources are aligned, and we want to make sure that we eliminate waste and redundancy throughout the specialty. So going forward, the college programs, as I said, are being assessed to assure that they're aligned with the strategic plan. We'll develop the strategies to implement the plan, and that any new college program will be tested and assessed against the plan. Now, maybe some of you guys are saying, "Okay, wait a minute. I've seen the slide. All you guys, every meeting, you show me a slide that has all these, pillars of the Roman Forum with advocacy, economics, education, research, and quality and safety written on them. Does the new plan throw that away? And I want to say absolutely not. But the new plan recognizes that to be successful in the future, we have to integrate our activity between the pillars. I've talked about it like driving rebar from one end of that pillar to the other to make sure that we don't let the pillars become silos unto themselves, but rather all the great activity going there is sort of focused on the objectives. It's going to require both internal coordination and external collaboration, but I think that that's where our new strategic plan wants to take us. Finally, we need to think about some of the mega issues. Mega issues are the overriding issues of strategic importance that sort of will cut across all of these goal areas and outcomes. At the board meeting, we had Frank Lexa sort of put on a project where he and a group of colleagues have created a work group to look at to bring some of these mega issues to the board, so we can sort of discuss them in a roundtable kind of way, a business school type atmosphere, to make sure that the board is thinking strategically about the future. The challenges of health reform, our changing practice patterns, including more employed physicians, our declining reimbursement, have created some unprecedented challenges for the specialty. But I'm always the guy that says challenges bring opportunities. And so one of those opportunities was to revise our organization's strategic plan to provide a credible vision for the future that can be shared by the membership. Obviously, we want to emphasize the areas where the college is uniquely positioned to support and represent the members. And quite frankly, I consider it to be an exciting time as we start looking at all the ways that we're changing and the many ways that the college can change and adapt to be valuable to our members. So maybe some of the questions that you guys are thinking about is, how will the strategic plan affect our state chapters? How do the state chapters collaborate to help achieve the goals and objectives of the plan? And what are the opportunities for the college to help state chapters in their mission? And so these are some of the questions that we might want to hear answers from you all. And so kind of now is the opportunity to begin talking about that. And Trina, I'll let you Tanya, take control back of my computer, and pretty close to what I said, maybe 25 more minutes, and to talk about some of the questions and answers. So thank you all for listening to me. I really do appreciate it.
Okay, great. Thanks, Dr. Allen. That was a lot, and I really appreciate it. I know you, I didn't even hear you pause for a drink of water, so I appreciate you doing that. That was a lot of great information, and do you mind, addressing that? How do you think the board and the staff here feels that the chapters do fold into the strategic plan? Do you have, any initial thoughts on certain places that they can plug directly into currently?
Well, obviously in the big picture of communicating with radiologists, I like to say in the trenches, but in the grassroots, or however you want to do it. But the state chapter meetings are incredible places for radiologists to hear what's going on, to hear some of the messages that can help them in their practices. Because I do believe that that this time healthcare reform is probably not going to be able to be impacted very much from the top down, but it really will be how are individual practices and individual radiologists going to adapt to fit in and be effective in the new paradigm. And I think that helping each other not be resistive to change, to look and see how other people are adapting to change and how we can take the great things that someone's doing in Colorado maybe and bring them to Mississippi or to Virginia, and learn together how to do that. And so I see the state chapters being able to take the information that's being developed and collated, and then bringing it back to the radiologist.
Great. Thank you very much, Dr. Allen. We've got folks, we've got some questions coming in, and everyone, do capitalize on this time. There's a question box there on the right-hand side of your screen, and go ahead and type it in.
Tanya, I think that if you've taken my screen away from view, I'll go back and check my email. It seems like we had a few questions that people submitted in advance, and I'm happy to take a look at.
We do. I've got one here live, and then I'll kind of queue them up. One live that just came in.
Okay, great.
And I think this might be one that staff can address here. Is what tools are available from ACR to help state chapters foster meaningful member engagement and to enhance effective member communications? Agree that this is critical, and we certainly agree that indeed making sure that within each state that our chapters and our members, all the members of the chapters do have the ability to communicate with each other and talk about issues. So if you're fine with that, I think Brad Short can talk a little bit about what we might have coming down the pike to help the chapters in that area.
Well, first let me thank the questioner for the question. I think it's a terrific question. Communication and collaboration are essential elements to the success of any organization. One of the things that the college is focused on is the ability for you all to be able to communicate among yourselves. And the establishment of the chapter portal over the last couple of years has begun that process of being able to facilitate discussions among chapter leaders, among the various chapters, to ensure that you guys are learning best practices from one another and identifying roadblocks and challenges along the way. I think this question, though, looks more at the potential for tools that would link the individual chapter to its own membership and allow sort of a communication or forum to exist. I can tell you that the college currently is looking at some software to further engage some of our subspecialty commissions with some of the subspecialty groups that they represent. This type of software we think might be able to be utilized in other capacities similar to the one that the questioner raises. So we will look into this further. We will follow up with you as we learn more information, but it may be the type of tool that, that could be utilized for that purpose. I hope I answered the question okay.
Okay, great. I think we've got some screen sharing going on here for everybody. I think they're getting a little bit of everything here. So thanks, and I hope that I do hope that that was able to answer the question that came in. I want to go ahead and make sure that we address the questions that came in. I know that there was a question about membership dues. I think it was that came in via the poll, and someone asked, when did ACR intend to lower our membership dues that are dues being what they are, were making it difficult for them to be able to recruit members themselves. So, Dr. Allen, do you want to address that?
Yeah, so I found, I found some of these questions and that had come in and ahead of time, and I'm sort of happy to address that one. I mean, hopefully, the strategic plan again emphasizes that we want to be able to provide the most value, the most bang for the buck for membership dues. But most of what the college does to help members, that is, again, running our member services program, running economics, running advocacy, or running the Health Policy Institute for health services research and those sorts of things. are the types of benefits that that we feel like it's important for our membership dues to go to. And despite the fact that you know, we look at our own incomes going down in the world of the Washington politic and all of those things, most of what we need to do to maintain our leadership positions in advocacy and economics and all of those things continue to continue to have costs and continue to have dollars. And so I think we have to get to the right balance of how much it costs and the benefits that we get. I hope everybody believes that they get, you know, $20 a week out of the college, but I don't take that lightly. And so again, the strategic plan will certainly look at ways that we can maximize every dollar. But as we start decreasing what we do just to make dues go down, we may not be able to provide the services that people expect and want from their professional organizations. And so, you know, I hope the vast majority of folks see $20 a week as a reasonable investment. We have put hundreds of thousands of dollars into our careers and our training to practice the way we do, and a modest continuation of an investment like that, you know, again, that modest weekly investment to assure that people are looking out for our interests, to me is worthwhile. You know, other models for revenue, such as you know, industry-sponsored stuff. You know, the RSNA kind of has their big, you know, their budget funded mostly, you know, by you know, their meeting and their trade show, and so, you know, there are just so many, you know, sources of revenue. But I hope that you know, from the journal to the economics and health policy research and the economics and advocacy, that people find that we're achieving a pretty good balance with dues and services. But certainly, if anybody has other ideas on that, I'm happy to address it. My friend Phil Lund asked a very provocative question, and one that frankly many of us have been thinking about, and that is, how is the ACR addressing membership in the era where more physicians are being employed by health systems? And you know, there is certainly the idea that well, if I don't have to worry about where my paycheck's coming from, why do I need to send money to the college? I guess first is if the health system is getting the money to pay radiologists from you know, payment policy and reimbursable fee for service and that sort of thing, then somebody still needs to look out for that, because as that goes down, then what the health systems will be able to pay you will go down. Certainly, I would hope that employed physicians will negotiate as part of their packages, you know, a desire to maintain their, you know, status and professional standing with their professional organizations. Again, I think the idea is that we're better together, that we want to be involved with people. You know, we want to be part of something bigger. We want to be part of something that's taking, you know, what our livelihood is and what we, you know, find important in practice to a better place. And I think that, you know, that you can rely a lot more on the college to help you get there than you can your health system. So while I think that it's a very valid question and one that we'll look at, I think that we have to, as we go, look at the balance. I think that we want to make sure that health systems and other employers of radiologists in the future see the value of having their physicians maintain their professional status. Tanya, the last question that I had is, what can we do to prepare our practices for the dramatic changes in healthcare, especially consolidation, that have become? And I think that is part of the way the strategic plan is looking, and that is that if radiologists can show a leadership role in figuring out where radiology fits, I think many of us who have looked at this issue fear that the easy path is that we just become a commodity. And I hope some of you have seen Elliot Siegel's video that he captures from I Love Lucy, where Lucy and Ethel were in the chocolate factory and they were wrapping up the little pieces of candy for the boxes, and the conveyor belt went faster and faster and they couldn't keep up, and they were doing more and more and more for less and less and less, and all their supervisor could say was, "Speed it up in there." And the whole atmosphere, to me, and Elliot points out that this is kind of where we're headed. This is what a true commodity would look like. And so trying to prepare radiologists to figure out how they can get off that gerbil wheel and more into providing more value to their referring physicians, patients, and health systems is what this strategic plan is all about. And I'm hopeful that we're taking a step in that direction.
Okay.
Tanya, do you have some other questions?
I do. I've got one here. How do we initiate a strategic plan, and what is an appropriate time interval for conducting one?
Do you think that question means for a state chapter or for an individual practice?
Correct.
Or
yes,
that this wasn't any good and we're going to start over again?
No, it's from a chapter. So I think the asker was saying, if my chapter were to embark upon a strategic plan, what is, how do we initiate that, and how long do we think, it would take us from beginning to end to get one in place?
Well, I have to tell you that I am, so I'm in a small group practice in, a moderately small metropolitan town, and frankly, my group has never had a strategic plan, and so this whole process was eye-opening. But I have to tell you that I found it a remarkable exercise, a wonderful exercise, just to sit down and talk it through and figure it out. For us, we had, we wanted to have, for us, the college, we wanted to have very broad representation. So our strategic planning committee, was, almost, 15, I think it was 15 or so folks, to get that broad representation between private practice and community practice and young physicians and old physicians, and the whole spectrum of what we were looking for. And so, there were a lot of people, a lot of research. And so it really did take us about a year. But I suspect that you could, if you had a few people who wanted to get together, you had the ability to, look and ask the right questions of your chapter memberships. I would think you could do it in some period of months. And as I said, it depends on how big you are and what your resources are, whether or not you would want to hire a facilitator. As I said, we found having a facilitator to get us back on track and those sorts of things very, very effective. So even if the strategic planning committee is small, and even if you just sit around on a couple of days at a retreat and talk about the issues, I think that's incredibly positive. And if you want to go bigger than that, that's great too. Certainly Pam Meckler at the ACR can share more about what the college's process looked like.
Great, thanks so much. And this actually gives me the ability to plug some stuff that we have coming from the Office of Chapter Development. As many of the folks on this call know, we've embarked upon a thing that we call CLASS, which is the Chapter Leaders Advancement Series. And this is actually the kickoff to that. And what this will be is a series of webinars that will either, starting out, be every other month. And what the thought is to really educate our chapters on what it is to run an effective business model of a chapter, good governance at a chapter level, the fiduciary responsibilities, all those things that it takes to be an effective state chapter. And one of those things really is strategic planning. We have lots of resources that will be coming down the line, and really, this was, as we said, this really is just the beginning of the conversation of how we intend to support the chapters moving forward and make sure that they have really good, sound, robust business models and then a good governance structure and things of that nature. So strategic planning is certainly something that we intend to cover sooner rather than later. We're also going to look to possibly some of the folks on the call and work within the realm of the chapter portal to see which chapters currently do have a strategic plan, or are they willing to share that with the group and things like that. So it's a good question, and it's certainly something that we plan to support the chapters and help them. If they're willing and want to go through the process of a strategic plan, we certainly intend to support that and help them make that happen. So, all right. So it looks like we have. I don't have any more questions coming through the pike. We've got about 6 more minutes, which is right here towards the end. So Dr. Allen, I figure we can go ahead and do some kind of parting thoughts and parting words, and then I'll wrap up the shop, and we'll let everybody go move about the cabin freely. So.
Well, super. Well, listen, guys. I hope that this is what you envisioned it would be. If it's not what you envisioned it would be, tell us what we can do to make these better. I am happy to be available to have chats like this. Maybe we can figure out ways to make it even more interactive than the electronic questions and that sort of thing. And because we really want to hear what you think, what your feedback is, what would be better. I am certainly willing to volunteer any member of the board to come talk to you about different things that are going on in the chapter. We can certainly dig more into the strategic plan and talk some more detail about what the strategies will look like, and as we go through the program assessment and how we align the programs of the college to our resources, what are the most important things for the members. And I think our best understanding of what that is will come from the chapter leaders. And so please give us your feedback and suggestions for what you want these to do. We hope this is going to be the beginning, not just sort of a one-and-done kind of event. I know Bill missed being here, and I hope the next time he'll be able to be with us, and you can have an opportunity to ask him more specific questions as well. So thanks.
Okay, I think we actually have a couple more questions that have come up real quickly.
We do. They've come up really quickly, and I know that we only have 4 minutes, so I'm going to quickly, fielding this is kind of tough, but let me just pull one. And again, if your question is on cue, it will absolutely be addressed. We will certainly, make the answer available to you. But here's a good one that I thought I might share. How has the new strategic plan changed from what we are focusing on this year? So I think what the intent is, where do we think we were going, and how has that plan changed that? If you can cover that in 3 minutes.
Oh, I certainly can. You know, I think that the strategic plan will not necessarily change what our advocacy agenda is going to be like, what our other specific plans regarding things like Imaging 3.0 are. I mean, I hope that we didn't include the phrase Imaging 3.0 or programs like the RSNA Radiology Cares into the strategic plan, but certainly the plan looks and feels an awful lot like both of those initiatives. And so as far as the direction for the profession, I'm not positive that it's a huge change. It just helps us have it on paper so that we can look to the programs and the resources of the college and make sure that they're all aligned. It helps us keep things from being siloed here in economics and here in advocacy and here in quality and safety. It helps us look across that and say, okay, how can we use resources from all of those pillars and all of those departments within the college to go in the direction, because it says it right here in the strategic plan, and that's the direction that we're going. So I wouldn't look for sweeping big changes in what you see from advocacy or economics or where we're going in quality and safety, other than that we want to try to get the tools in your hands that will make your practices better so you can provide your own value to your patients and the healthcare systems in a way that an organization can't do it for you.
Okay,
Steve,
great.
that sort of idea of empowerment of the membership and the radiology professionals.
All right, great. Well, thank you so much. I appreciate that. We are just about a minute away, and again, as I stated in the beginning, we're certainly going to honor this hour for everyone. There really were only a couple of questions we were not able to get to, and again, we'll certainly circle back on that. This is recorded. It will be made available on the chapter portal. Look in your chapter executive update that I know that each of you just read so feverishly and can hardly wait to get from my inbox once a month. That's coming out next week, and we'll have this posted so you're able to share it with your chapter leaders. And as Dr. Allen said, this is the beginning of this conversation. This is just the beginning of what we hope that this relationship is going to be moving forward. You're going to drive this. You're going to let us know what you thought about tonight. You're going to let us know how good we did, how bad we did, what you thought. And a survey is going to come to you shortly after we log off. I'd appreciate it if you would go on and answer honestly and let us know what you thought. And with that, I think we are rounding out the hour, and I thank you all sincerely for your time. I certainly thank Dr. Allen for his time and leading us through this fun journey of the strategic plan. And I think that's us.
Thank you, everyone, for participating.
Thanks again.